So testes develop in the abdomen, and the undescended testes are which have never descended in the scrotum. So before birth, they are formed in the abdomen. They descend through a channel, and then they come down to the scrotum, which is usually completed before birth. But they still, in some patients, some children can descend in the scrotum between 3 months to 12 months of age. It is prevalent in about 20% of the population, and then by 3 months to 1 year of life, it is only present in 1 to 2% of the population. So the main symptom with undescended testes is that parents will not be able to see any testes in the scrotum, and scrotum will be less well developed. And this is the main thing. It could affect one side, or it can affect both sides as well. So the etiology of undescended testes is unknown. It can there are multiple environmental factors which can lead to undescended testes, like first born male child can be affected from it. There are multiple syndromes which are associated with it. Up to 30% of the preterm babies will have undescended testes, or intrauterine growth retardation, which can also lead to the undescended testes. But in truth, the etiology is unknown in undescended testes. So in younger children, when they're born, is a testis which has not never descended in the scrotum. So there are multiple varieties in it. It could be what we are discussing now, which is undescended testes, which should have come through a path of descent, but sometimes it does not follow that path. So it leads to ectopic testes, which is not in the normal path, but it will be around the area which is bit swayed from the normal path. It could be ascending testes, where the testes has been felt before in the scrotum and then moved up, and that's what we can see in older population. That's ascending testes, which is a form of undescended testes, or it could be a retractile testes, where the testes moves up and down because of chemostatic reflux. So the testes, as we discussed, I mentioned before, it is developed in the abdomen, and then they migrate down to the scrotum. So they function better if they are in the scrotum. And that's what happens in majority of species. And if you see in fish or any other mammal, then the testes will be near the surface, and in human beings, it is in the scrotum. That provides a colder environment for them to work. So the fertility is better if they are in the scrotum. And the second reason is that if the testes is exposed to the warmer environment, which is in the abdomen or in the groin, then it can lead to malignancies. And the chances of cancers is about 3 to 5% higher risk as compared to normal population. So these are the two main reasons which will be caused by undescended testes. And the third thing could be that if the testes are not in the scrotum, they can be, if they're in the groin, then they can be damaged by a small trauma, like playing any sport activities. So the treatment is generally required between 6 months to 2 years. We used to do operation on this in about 1.5 to 2 years, but now with the evidence coming in that the cells are salvaged if the operation is done on the testes sooner. So we tend to operate now between 6 months to 1 year. And the operations depend on where the testes is felt. If the testes is in the groin, then it can be done with a single stage operation to bring the testes down to the scrotum. If the testes, however, is not felt in the groin, then that condition is called impalpable testes, and that means the testes is most likely is in the abdomen. And It generally does not require any further investigations except examination by a clinician. And if they are sure that it's impalpable, then it needs another examination under anesthesia. And if still the findings are same, then it most likely requires a two-stage operation. There is a very small possibility that testis has not formed. And in those cases, the clinician can discuss with the parents that the other side should be fixed or not, because the testes on this side probably lost. The reason for that could be the twist of the testes or some clot in the blood vessel, which led to demise of the testes. So as I discussed earlier, the testes work better in the colder environment, which is outside the body in the scrotum, and that gives them best chance. So if the testes is affected, is on one side, like undescended testes is on one side, then the fertility is nearly as good as you have two descended testes, which is about 85 to 89% fertility chance. And if both sides are affected and they were never in the scrotum, then the fertility reduced to 50 to 60%.